Cool. All right, so we're recording. Thank you everyone for coming to this Southern Vermont Young Professionals webinar. We're very excited to get some folks on to talk about health insurance, some of the basic overview and terminology, as well as how to navigate the resources that are available. So we're really thankful. I will jump in. I will be sort of managing the Zoom and any PowerPoint action that is needed of me. Otherwise, I'm going to go ahead and turn it over to Daniel Quip to introduce himself.
Thanks, Casey. My name is Daniel Quip. I work for SoVTYPs, which is the Community Action Agency in Windham and Windsor County. I work in the Brattleboro office and provide healthcare assistance services for people in Windham County. So SoVTYPs typically is working with mostly kind of low to low moderate income folks, but for our healthcare services, we work with whoever needs them. So that's not an income eligible service. It's also not an age restricted service. So you could be, young, old, somewhere in between.
Awesome. And we know that in Vermont, the young professionals demographic is all fairly relative, right? So
That's right. I think I might even make it.
I think you're in there. I think you made it in. Awesome. So yeah, what we'll do is I'll see if I can get my screen share going. Just to get that on. Cool. Can everyone see that? The PowerPoint slide? Okay, awesome. So yeah, here we go. I'm gonna go ahead and go to the next slide. So we did Daniel's intro and Britt will be here momentarily. I am some of the goals for this evening. We're gonna go over some basic insurance terminology. There are a lot of stuff. Full disclosure, this will be great information for me as well. How to navigate the Vermont Health Connect website, which I believe Daniel will be spearheading, and what you need to know as a health insurance consumer, incredibly useful. And we'll have some time at the end to ask some questions.
Great.
All right. So our disclaimer on this one, this is for educational purposes. We're not here to give any specific individual medical, legal, insurance advice. Can't tell you what plan to pick. And we're not insurance experts. I know I am certainly very much not, which is why I'm excited to learn a little bit more. So I think we've got Britt coming in right now. Awesome. Hey, Britt, welcome.
Hello.
Cool. So we did a quick little introduction with Daniel. And so I'd love to turn it over to you to do an introduction for yourself, and then you can guide me. I'll be your PowerPoint clicker here.
Sure. And thanks everyone for the patience tonight. I had a longer day in clinic than expected. My name's Brittany Schmidt, and I'm a chiropractor here in Brattleboro. And I thought this would be a great event because working in healthcare, I find a lot of people who don't understand their plans, who have a lot of questions about their plans, or say things like, oh, you were in network, so I thought you were covered. I don't understand why I have this bill. And I was just really surprised how many people just maybe didn't even know basic terminology. So I thought that this would be a good chance for us to maybe clear up some of that, especially because as young professionals, this might be a little newer to us, right? With being off parents' plans or whatever that might be. So yeah, that's a little bit about me. And I think you already covered this disclaimer slide, but As for Daniel and I, there's no advice here tonight, no medical, legal advice. We can't tell you what plans to choose. My purpose here is purely educational. I just want you to walk away with maybe some information that you didn't previously have. So yeah. All right, so just some really basic terms I wanted to start off with. A premium is basically what you pay for your plan every month. So that would be your monthly cost. For some plans, you might not even have a monthly cost if it's a state-run plan or something like that. But for most insurance plans, there's a monthly cost for your plan. And that does not include your deductible, copay, or coinsurance or anything like that. And by the way, guys, all these definitions and terms are pretty much straight from healthcare.gov. So if you want more information on this, then you can just go there. They have a great glossary and you can scroll through all of their terms. So when a provider is a network, that means that they have a contract with insurance. So basically, like for example, I am a network with almost everybody around this area. Blue Cross Blue Shield's a really popular one. So I'll refer to that one a lot. But basically that means I have a contract with Blue Cross, means that you have a contracted rate with anyone that you use that's in your network. Sometimes that makes a big difference. So if you go to a doctor that's out of network, you might have more costs on your end that aren't covered by your insurance. So whenever you're looking for a provider, a really good place to start is your insurance, because you can just look up who is a network and who is not. And most of the time your insurance will provide for you some sort of list. Sorry, I'm sorry if that was loud. My heater was on behind me. But anyway, so that's what being a network means. And then just really briefly, there are different types of plans. Medicaid is a state-run plan. In Vermont, we call that Green Mountain Care. And that's for anyone who might need some income help with insurance, people with disabilities, pregnant women. Medicare is different. So that is federally run. So it looks the same across the country most of the time. And that's for older people, so not really applicable to our group here. And then HSAs and FSAs are something that comes up a lot. Those are like these little savings accounts that you can have. Most of the time, they're offered through your insurance plan, and you can use that for all sorts of things like chiropractic or acupuncture. Basically, if it falls under the umbrella of health, you can use it. So those are actually pretty nifty for a lot of things. And then commercial insurance is what many people have, usually through their employer. So that would be things like MVP, Harvard Pilgrim, Blue Cross Blue Shield, things like that. So I'm ready for next slide, Casey. Okay, so these are probably the terms I see people confused about the most. So a deductible is the amount that you have to cover before your insurance kicks in. And this is really important when choosing a plan, seeing how high that deductible is, because this is a great example of what I see all the time in practice is people will come to me and say, you know, oh, I looked you up, you're a network. I'm excited for chiropractic care. I looked at my benefits and I have coverage. And I'm like, that's great. Let's get started. And then we bill their insurance and we get back an explanation of benefits that basically says insurance isn't covering any of this. And then unfortunately, I have to bill the patient. And that's when they get a little upset and they said, oh, I came to you because you were a network and you know, I thought this would be covered because I have, you know, benefits. And I said, yeah, but your deductible is $700. So anything that is healthcare related has to meet that deductible first before anything else kicks in. So after you pay for your deductible, you know, it's usually pretty good. You just have co-payments or co-insurances or whatever else you have extra. But essentially you have to meet that deductible first. So if you have a very high deductible, that might be beneficial for you to look into things like HSAs or FSAs, just to maybe help out with that. If you know, aren't very sick or, you know, don't go to the doctor a lot, a high deductible might not be that big of an issue. But that's probably the biggest thing I see people not understanding is about that deductible piece. The co-insurance is similar. Basically, you have an amount, a percentage that you will be responsible for after the deductible. So this is a good example here on the screen. So it says if you're allowed $100 and your co-insurance is 20%, if you've met your deductible, you only have to pay that $20. However, if your deductible is still outstanding, you will have to pay it in full. So that's another thing to pay attention to when you're picking a plan, or these terms. And a lot of times, and on the healthcare or the Vermont Connect site that we're going to, that Daniel will go over soon, it'll say there like, oh, this is how much the deductible is, this is how much the coinsurance is. So pay attention to that. It might look like a really good plan, but if it's a high deductible or a high coinsurance, you might want to consider some other things. And then the copayment is basically a fixed amount that you have to pay your provider every time you go to the doctor. So that might be different. Some copayments are waived for primary care. Actually, most of the times there is no copayment for primary care. Sometimes if you're seeing a specialist, it's higher. If you go to the urgent care or ER, it'll be a little bit higher. A lot of times those are printed right on your card. So you can always take a look at your card and see what your copayment would be, but you should expect to pay that, especially if you haven't met your deductible each time you go to the doctor. Okay. You're doing great, Casey. This is great.
Woo!
Okay, so just when you think like you're in the clear, you've paid your deductible, maybe you had something happen, there's still something called out-of-pocket maximums, which sounds like it should be the same thing as a deductible, but it's not. So this is the most you will have to pay before insurance completely kicks in and covers it. So after you've met your out-of-pocket maximum, which sometimes they're very high, sometimes they're like $8,000, sometimes they're, $4,000. It just depends on your plan. You don't really have to pay anything else. So except your premiums, you still have to pay your monthly bill. But essentially, once you've met that, you're covered. So a lot of times, like I'll use myself for an example. I had surgery and I wanted it done in January because I knew I would hit my out-of-pocket maximum. And then I knew for the rest of the year, most of my covered services would be for free. So, or not free, I'm still paying for it. That's a bad way of putting it, but I wouldn't have any out-of-pocket expenses after meeting that. So pay attention to that maximum too. Oftentimes, if you're having a plan that's not just for you, but maybe a spouse or child, it'll be a family maximum and an individual maximum. So pay attention to those things. That's important when picking your plan. Pre-authorization comes up quite a bit in my clinic, and that just means that you have things that are covered under your plan and things that might require authorization from a medical provider. So for example, you might have like things like acupuncture or dry needling is covered under your plan, but you'll need to be authorized to say, actually, you need this. Another example would be that if you have, maybe 12 visits with the chiropractor, for example, or a physical therapist, and you're not quite meeting your goals within 12 visits, and we want to do more visits, we would have to request more visits from your insurance. So they would have to be authorized before having those visits. Otherwise, you would be expected to pay for that. Coordination of benefits. This might be something that is actually relevant to this subset. And that's when you have two plans. So that's when maybe you're still on your parents' plan and you're having another plan on top of that. Or maybe you have, a Green Mountain Care Plan plus MVP. And basically when that happens, those insurances have to decide who is going to be responsible. What's the primary insurance? What's the secondary insurance? And a lot of times people think like, oh, I have two insurances. I'm covered. That's good. I'm like double covered, but that doesn't unfortunately work that way. A lot of times what they'll do is the secondary insurance will only cover what the primary insurance does. So, and I'm sorry, I keep using chiropractic, but it's what I'm familiar with. But if there is, let's say, a therapy I want to do, like electrical muscle stim, and that is not covered by Medicaid, but you have MVP, most of the time MVP will use what is covered by Medicare or Medicaid in that situation. So it also wouldn't be covered. So oftentimes you'll get like an explanation of benefits or a coordination of benefits packet, and it says like, this is not a bill, it's just explaining your plan. I know it's boring, but read through it. That might help you determine, who's your primary, who's your secondary, what is covered and what is not. All right, you can go to the next slide here. And that's, well, I went through that really quickly, but that's, I tried to make it really concise and short because talking about insurance isn't necessarily sexy. It's actually pretty dry, but nonetheless, it's super important because if you don't understand your health insurance, you might not pick the best plan for your family or for yourself. And you, unfortunately, you might be stuck with a bill when all is said and done, even if you say like, oh, I thought I had really good insurance. If you don't understand terms like copays or deductibles, you might have to pay more than you originally thought. So I think we should keep moving and have Daniel walk us through the portal, because this is where most people will find their sites or their plans if through the site. It's a great tool. I've used it myself. And after that, we can open it up for questions, if that sounds good to Daniel and Casey here.
Yeah, that's great.
Great, thank you.
And, you know, we went through that quite quickly, but a lot of those terms I'm going to kind of cover in like a sort of real world, you know, what it looks like in your kind of plan choice sense. So I'm just going to share my screen right now. So let's
Stop.
do that.
There we go.
Okay, so I have this wonderful technology called pieces of paper that I printed out with some notes on it. I turned them into a PDF just because like everyone can read a PDF, and you know, so I've made that available to Casey, and you will share it out with whomever wishes to have it. So this is the Vermont Health Connect website. I was really, you know, wanting to like tell you, like, go to this very easy to remember web address, but if you look up here, it's actually really hard. So just Google Vermont Health Connect and you'll find this eventually. And if you scroll down, you'll see, you know, some pretty clear kind of messages. So if you are new to Vermont Health Connect, you would know that you're new, right? Because you've never engaged with Vermont Health Connect before. You would go here. If you already are a current customer with Vermont Health Connect, you can go here, and both of these links take you to the same place. If you, well, so right now is open enrollment, which is the one time a year that you can change a plan, whether you've had a life change or not. And it actually runs for a smaller amount of time than it used to. It only goes until December 15th now. So if you currently have health insurance through Vermont Health Connect, or even through an employer that is no longer really affordable to you, you can come onto the Vermont Health Connect website and you can take a look around and shop for a different plan. The whole point of these websites, you know, each state has one, is it's a marketplace. So you can actually compare and make a choice as a health insurance consumer. Outside of open enrollment, you can change your plan, but only in certain circumstances. So it's usually like your income has changed, the number of people in your household has changed, you lost coverage because you changed job or something like that. If you lose your insurance, you have, I think it's 60 days to get it taken care of. So if you lose insurance, you know, don't freak out. Get in touch with Vermont Health Connect and they'll tell you if you're eligible for new coverage. From a COVID point of view, right now, if you lose your job and you lose insurance to do with your job and you have no income, you can get on Vermont Medicaid really quickly and really easily. So hopefully that doesn't apply to anybody that's on this call, but if this is recorded and goes to somebody that does apply to, then hopefully that's reassuring for them. And you can see here how to get in touch with various people. So if you call this number, that's Vermont Health Connect in person, you might end up with me, except it wouldn't be in person. It'd probably be on Zoom or on the phone. And then you can find answers online. And so we're going to go here. And this website's really text heavy. And actually, it's kind of helpful, but like, you know, it's not the most beautiful website in the world. But we're going to go to this thing here, the plan comparison tool. And even now I have to make another click. 2021, that is the year that you're aiming for. This open enrollment period is to select a plan that would begin on January the 1st. So even if you were to get insurance today on November 19th, it wouldn't begin until January 1st, and that's important to know. So we're gonna just click continue here. There's a video. You don't want to watch it. I mean, you can, but you don't need to. And like I say, this website's pretty text heavy, and it's actually really important to read each of these things carefully, right? So first of all, they want to know who's going to be covered by the insurance, like who's actually looking for coverage here. So I could either take a real world example if anybody wants to give me one, or I can just put in my hypothetical person. It's up to you. I really don't mind.
volunteer as tribute. Pick me.
Okay. All right, Casey, you want to tell me how old you are?
Yeah. All right. I'm 28.
Oh, magic age. Okay. All right. Okay. And then you have questions here, you know, about your health. These are optional, and these definitions here are pretty vague. So I would recommend just letting them be. This one here is about very specific procedures, so it's worth taking a look at. So if you know that you have one of these procedures in your near future, and this plan is only for the next year, so it's really, is one of these things coming up in the next 12 months, then you should click it. But if you don't have any of those in your future, just leave it be. Again, you can, you know, read what it says here. And if you get confused by any of these terms, they have these helpful little question, I don't know, buttons or whatever you want to call them. And so you would check those boxes if that was relevant to you. Okay. And if there's more than one person in the household who needs coverage, we can add that person. For simplicity's sake, we'll just stick with one person for now. Okay. The only other thing I want to say here is, like, there's this little button up here for advice and explanations, and it actually is kind of helpful. It's a little text heavy again, but like, you know, if you find yourself confused by insurance terminology, there's some good stuff up there. Okay, so the next step is finding out whether you want to get help paying for the coverage. So like the big thing with the Affordable Care Act was that it provided premium subsidies called advanced premium tax credits to help with the cost of having an insurance plan. And so it's based on your income. It's also based on the household size. So I would recommend that everybody clicks, yes, I want to find out, because otherwise you don't even need to use this website. You could just call Blue Cross and arrange your insurance without any subsidy. So, and even here where it says if you earn less than this, I would just say yes, and then put in this relevant information here. So now we're asked how many people are in the household. So as far as the healthcare system, well, as far as this healthcare marketplace is concerned, your household is really like who ends up on your tax return. Okay, so Casey, I'm not going to dig too deep into your personal situation, because after here it gets pretty personal. So I'm going to just say it's one person in the household. Okay, and then the next question is asking, is employer coverage available to everyone in the household? So this, you know, if your employer gives you coverage, or your employer offers you coverage, and, you know, you pay a certain amount out of your check each couple of weeks or what have you, you could say, yes, they give it to me. But if you know the reason why you're on this website is because actually that employer coverage that they offer you is more expensive than you really want to pay for your insurance, then you might be eligible for a plan through here. The way that they work it out is a fairly complicated calculator. And so if you find yourself clicking yes, it might then direct you to a calculator. If employer coverage isn't available to everyone in the household, you click no. Okay. And then this next one is asking about household income, and you'll notice that it's expected household income in 2021. If you have a salaried job, it's probably fairly easy to work out. If you have a couple of jobs, it gets a bit more complicated. If you're self-employed, it gets even more complicated. If you juggle in all kinds of different work, then it can get pretty complicated. The whole thing with this part is that you're projecting, and the result that you'll get out of it is an estimate of a tax credit. So if you project that you will earn, more, and then when you do your taxes in the following year, you actually earn less than that, you may end up with a bigger tax credit when you do your taxes. If you project, you in, I don't know, 50,000 and you end up earning 70,000 and you were given a subsidy based on your projecting 50,000, you will pay back that subsidy to some extent. I don't know the numbers on that, but so it's really about projecting your income. So I am going to just pick an income for you. It's not one of those. I'll say this. No, not that. Oh, not even that. There we go. And then once you do that, it'll tell you what subsidy you're eligible for. So you will be given $449 per month off your health insurance premium, right? So the premium is what you pay every month, whether you use your insurance or not. And furthermore, you're eligible because of your circumstances for cost sharing reductions on this silver plan. The number relates to a percentage that the plan will cover. So the plan will pay for 73% of whatever, and you will pay for 27%. That's how most insurance plans work, some sort of percentage kind of, arrangement. Okay, and then sometimes when you do this, depending on what you put into it, you might get big red text here. Read it, because if it's red, it's probably kind of important. And again, it is worth reading this stuff. This is an estimate. If you find that you have a complicated situation and you want some help with it, call Vermont Health Connect. Okay. So we're just going to go to continue. Do you want me to admit them? There you go.
Here we go.
Yeah. All right. So let's see what's on my notes. Okay. This is kind of like the most important and complicated and part of the process. So we put in Casey's, hypothetical circumstances, and it's kicked out 28 plans. So how are you supposed to differentiate between these plans? There's a few different ways. Brittany kind of mentioned this earlier. If you have a provider that you're already working with, like a primary care physician or a provider of other services, physical therapy, mental health therapy, some other kind of, thing that you see fairly regularly, you probably want to check which insurance they take. In Vermont, through this marketplace, you are either going to be getting Blue Cross Blue Shield or MVP. And, they both offer the same sort of level of coverage at the basic level. And then it's kind of, structured it differently for all the different plans. And it's, some of that's about money and some of it's about how many services you can get and all that kind of thing. But to give you a real world example, I had a provider who I used to use my Blue Cross card with. I changed jobs. My employer offered MVP, not Blue Cross. So I had new insurance and I had to change provider because she wasn't able to take my MVP insurance, which would have meant that I would be paying out of pocket for everything. And that kind of defeats the object of insurance. But, you might have like a really beloved provider, and that's one of the decisions that you need to weigh. So that's one way to do it. So if you know that your provider only takes a certain plan, you might filter that out. And now, so you're only looking at Blue Cross plans, right? Or vice versa. I'm going to leave them both open because we don't really know at this point. So then another way to kind of like figure out which of these plans is worth bothering with is to sort them in different ways. So you might sort them by premium. So this is how much you're going to pay each month. Depending on your budget, you might have a figure in mind that like what is affordable for you for a monthly premium. The general rule of thumb is that the lower the premium, the higher the deductible, the higher the out of pocket, right? So you can see For this plan, you would pay $42.30 a month, which is the lowest premium out of all these plans. But you would have a medical deductible of $7,250. And after you've met that deductible, there would still be a little bit left for you to pay because probably of co-insurances and that kind of thing. So in the worst possible circumstances that year, you would pay $8,400 before your insurance plan started to pay for the services that you needed. So that's one way to look at the premium. The other is, let's see, to go the other end of the spectrum. So you could pay $490 a month, but your deductible is only $350 and your max out of pocket is $1,400. You will pay that $490 a month every month for 12 months, whether you use your plan or not. Okay, so when I've had to make these kind of hard decisions, sometimes what I've done is I've sat down and projected out, like, what am I actually going to use my plan for over the next 12 months? And not only what am I going to use it for, but like, what am I going to use it for that I know is covered, right? Some things, some providers that I've used in the past, just, they don't work with insurance. So you really want to add that up and then make a decision on, whether you want to pay really upfront, by paying for a big premium but a low deductible, or you want to have a small premium cost and just take the chance that you won't really need to use your insurance that much. Those are two of the considerations. Another way to think about it is about risk. These are insurance plans. Like this is what's particular about insurance, right? It's like, it's a policy you take out that you hope you don't have to use. And healthcare and health insurance are not necessarily the same thing. Like you can have health insurance, but it might be that, you actually can't afford to use it and it doesn't ever become healthcare. So you might want to have a plan that is cheap enough for you to afford, and you only have it in case, Lord forbid, like you get in like a car accident or something like that and you end up in the ER or, some other terrible thing. My job as a healthcare assistant can't be to tell you which way to think about it, right? But I can at least kind of present some of these options. I have my own thoughts on what I would do given my circumstances. And when I've thought about that, some of that is like, how much money do I have available to me in the event of something bad happening, right? Do I have like a couple of $1,000s sitting around that I could use for my ER bill? If I don't, what's my plan? And then, the other kind of like way of looking at that is like, how much, do I have each month and how much can I put towards a health insurance premium? So I guess the other thing I would say about risk is that one of the things that you can do with plans like this HDHP plan, you can, Brittany mentioned before, health savings account. Some of these plans are eligible for pairing with a health savings account, right? So this plan here would cost you $53.90 a month. There's a deductible of $5,500. So you'll pay the $53.90, and then if you use your insurance until you've paid $5,500, you will be paying out of pocket. So you could, so my employer offers a health savings account and they provide a certain amount of money on it. It's usually like a debit card or something, or, just an online account that you pair with your insurance. And you use that card to pay for services. It's tax, it reduces your tax burden, it's pre-tax. So if you put $100 per paycheck aside into the health savings account, that's reducing your taxable income by $100 each month. And it's going into this savings account that you can keep for as long as you want. It's your savings account for healthcare expenses. So it's not like a use it or lose it kind of thing. You know, if you don't spend it all within 12 months, you still have some for the following year. So that's my employer. I wonder what they'll say about this. My employer provides a high deductible plan. High deductible plans are cheaper for people to provide, but they have much higher deductibles, you know. So to offset that high deductible, they provide us with a health savings account and they make a contribution towards that. So they're kind of hedging and presuming that most people won't need to use their insurance fully. So they save on the premiums and hope that when people do need to use it, their health savings account money will cover what they need for the most part. So that's another consideration. And then I'd say like the two other things that I would consider are prescription costs. So you'll see that some of these plans have a separate deductible for medical and drugs. So if you have a regular prescription that needs to be filled, you know, even if you were to meet your medical deductible, you might still have to meet a drug deductible as well. You'll see others don't, you know, some do, some don't. And then another way that I like to sort this is like worst case scenario. So you sort it by cost in a bad year, and this will reorder the plans to show you the one that if you had to use it a lot that year, how much it would cost you. And so now we have a different plan at the top of the list. The one at the top is the most preferential for however you're sorting it. So we got this MVP plan, some gold plan. There are 4 metal levels: bronze, silver, gold, platinum. And the bronze one requires you to pay the most. Silver, gold, platinum, you're continuing up, so that by the time you get to platinum, that plan I think covers 90% of your costs and you pay the 10%, whereas with the bronze it's a much more costly to you, but the premium will be much lower. So with this gold plan here, your deductible's $3,000. In a bad year, you could pay the medical deductible, which is $3,000, plus a drug deductible of $1,400, so that's $4,400, plus whatever you had to pay for premiums, right? So this bad year number is like all the premiums, all the deductibles, all the out-of-pockets. So that's another way to consider it. And then the thing I would do once you've got a couple of plans in mind, I would select a few of them and then hit compare. And now you see the plans here. This stuff's pretty basic. If you want to check whether the provider that you use is in network, you can go to the directory here. If you want to check that a drug that you use is available to them, you can check here. This summary of benefits and coverage is really helpful, but the best way to kind of look at that particular information is actually on this screen here, because it will put it side by side. So these ones are the premiums, right? And then if you go down a little bit to this plus thingy, you'll see here are the deductibles, right? So these plans, let's go back up to the premium. This plan here is going to cost you $349 a month, but it only has a $350 deductible. This plan is going to cost you $321 a month, but it has a $2,550 deductible. So there's a choice to be made there. This one is cheaper, $233, but it has a $3,000 deductible. The reason why these 3 plans were grouped together is because of their cost in a bad year. That's how we sorted it, so you can still see that sort of at the top of the screen. so is there an extra deductible for drugs? With these three, there is not. Out of pockets are different as well. And again, the drug deductible there. And then so here you get into the kind of the detail of what it would be like to use this plan. So Brittany mentioned earlier, with preventative care, your preventative care will be covered by pretty much all the plans, without having to go and pay something on the deductible. You might have to pay a copay or something, but other than that, it's fine. They want you to use the preventative coverage, right? So that's like a physical, other kind of routine stuff. If you go to a primary care provider, you're feeling sick and you want to get checked up, with these two plans, you will pay the deductible, right? So whatever that doctor bills insurance for that plan, you will be responsible for. So like I went the other day, it was $120. On this plan, you would actually pay a copay. You pay $15. They'll still bill insurance and it'll still go against your deductible, but you'll just pay the copay on that. Specialists tend to cost more. And then down here, you get into the world of what happens when you end up in hospital or in an emergency. So you're going to pay the deductible. So if your insurance is billed $2,000 for you to stay in the hospital, you're paying $2,000. With this plan, even after you've met your deductible, there'll still be a co-insurance, right? So if it was a $2,000 stay, you're going to pay $200 to your insurance company until you've met your maximum out of pocket, and then they'll just cover everything. And then scrolling down, you see the same sorts of kind of way to differentiate between the plans. And there's nothing really remarkable beyond that. So like that's kind of how you would, decide like which plan you think is going to work out for you. Once you've done that, you then just click the to enroll button and it advises you to print a copy of the plan. If you don't have a printer, just take a screenshot or write it down. And then you can either do it online or you can call and arrange your insurance. And your insurance will not be in effect until you've paid the first month's premium. So even if like you called and you got it all taken care of, if you don't then pay them, it'll get canceled by January 1st. So know that. And that's kind of it, really. I mean, like my services would be kind of like walking people through their options and listening to them and kind of, offering ways for them to think about what they need. I couldn't say to you, pick this one over this one, but I'd be happy to have a conversation and listen to what folks, think about those different plans and how they might impact their financial well-being as well as their physical well-being. I wish it was much easier and you could just say, yeah, we all have the same level of coverage and it costs the same amount, which is zero, but that ain't the case.
Well, great. Yeah, I mean, I think just having an awareness of those terms and knowing that the tool for comparing plans seems pretty robust once you know what you're looking at. And, it's a good way to kind of get started without, it doesn't feel as sort of daunting to jump into this whole process, knowing those things are available. So thank you so much.
And I would say like, the good thing right now is that you still have almost a month to make a decision. So like, become familiar with your options and talk. If there are other people in your household that are impacted by this decision, talk about it together and, work on budgets and look at what might happen in the next year and, make the most informed decision that you can. You don't need to make it today.
Great, thank you. So what we'll probably do is open it up. If anyone on the call has any questions, I will create the space for that. We'll also be putting, so we're recording right now, so we'll be putting this recording up on YouTube. I will have links to both the PowerPoint presentation and Daniel, did you want me to also include a link to the document that you sent along?
Yeah, I made it as accessible as I could, and
Great.
it's not fancy. I would also say that, my email address is dquipp, QUIPP, @sevca.org. And folks could email me and set up an appointment, or they can call SevCa. We're all working from home, but it'll get to us eventually.
Awesome. Well, great. I'm not seeing any immediate jumping in.
I would just say, guys, Daniel and I both spoke before putting this on, and what we both agreed to is that we really wanted this just to be a place where it was safe to ask any questions, because I know for me, like maybe a few years ago, I would have like looked at this and been like, I don't know what a deductible is or what co-insurance is. And so there are really no dumb questions when it comes to insurance. I work in healthcare and deal with insurance every single day and still have questions. It's not a simple process. So if there are questions here, please feel free to ask them. We will do our best. And then also please use the resources that are at your disposal. This website is really helpful. Even healthcare.gov, their glossary, like I mentioned, is super helpful. It's a wealth of information. And there's some Vermont good resources like Daniel that you can use, and that would be helpful when trying to weigh your options, because we just went over a couple scenarios and it can seem really straightforward until you get that bill that you weren't expecting. And that's what I see a lot in my practice is people think that they're covered and then they come back with this bill. And it's just something to plan for, like everything else. And we never quite know what our health expenses are going to be, but if we can project as best as we can and prepare as best as we can and have this kind of knowledge at our disposal, I think it really goes a long way.
Awesome, thank you. And to that effect, I'm going to stop the recording right now. So if anyone who's like on and wants to ask questions, like, great. So we